We, the Center for Global Development, we're a group that try and see how we can make the international system that supports global development work more effectively.
How do we finance infrastructure in the poorest parts of the world? How do we increase productivity in agriculture? What kind of policy brings out the best outcomes?
What CGD is about is you can ask those difficult questions that people refuse to ask and actually find solutions.
We're thinking about how climate change will impact migration patterns, how that will in turn have impacts on people's health.
It's challenging to be able to align budget with ambitious programmatic goals, but it can be done.
If you can help to make things a little bit better, that's a good way to spend your time.
Hello, everyone. Welcome. First of all, thank you all for those connecting from around the world joining us today for what I hope promises to be a very engaging and meaningful and even an enjoyable discussion on what's next for pandemic financing. My name is Victoria Fan, and I'm a senior fellow here at the Center for Global Development in Washington, D.C. Well, I'm really delighted to have such a distinguished and brilliant group of professionals who've been working on issues of pandemics and pandemic financing for several years from a range of perspectives from epidemiology, economics, insurance, and policy. The purpose for today's event is to really think through the next agenda for pandemic financing. And at the end of our event, I hope we'll have a clearer idea of some meaningful areas for policy action. Although it may seem like the past now, the COVID-19 pandemic, as we all know, inflicted trillions of dollars of economic losses, many deaths, and so much hardship and pain. And while it might just be easier to forget entirely about this period of the early 2020s, we owe it as a global community to our future generations to learn the lessons and be better prepared for the next pandemic and avoid such catastrophic losses in the future. Well, I won't use our precious time together to introduce our highly accomplished speakers, but I do invite you to learn more about them and their extensive body of work. And I also hope this conversation can be interactive and engaging. And so I sincerely invite you to send in your questions in the live chat or by email to cgdevents@cgdev.org. Okay, so our plan for today is the following. We're going to start with the first round of 5 minutes for each of our distinguished speakers to share their perspectives on what's next on the pandemic financing agenda. Nita Madhav will set the stage for reminding us just how large is the chance of another pandemic based on her newly published CGD working paper, and also what we need to better detect the next one. Christina Stefan will walk us through the importance of insurance tools while recognizing that there still are some lessons that we need to learn from some of our past instruments that were used. Ruchir Agarwal will zoom us out again to this broader landscape of pandemic financing tools and some of the key economic arguments that we should remember as we're making the case for investing in pandemics. And finally, Carolyn Reynolds will lay out some of the political and policy landscape, which is extremely dynamic, as we renew this really important and critical agenda. And then we'll have much time for real conversation and engaging discussion, including from questions from you, our audience. So we hope you'll really engage and send in your questions. And so without further ado, I'll pass it over to Nita to get us started.
Thank you, Victoria, and it's a pleasure to be here today on this beautiful morning. So I'm going to, as Victoria mentioned, talk about a new paper that we had just published in November with the Center for Global Development, as well as the Disease Control Priorities Initiative and the Lancet Commission on Investing in Health. And that paper focused on some new estimates that we have made of epidemic and pandemic risk. So why we did this is because we wanted to give policymakers a way to be able to prioritize how to make investments for preventing and preparing for epidemics and pandemics relative to other needs. And the methods that we draw from are risk modeling approaches that draw on principles from computational epidemiology, social science, economics, actuarial science, extreme events techniques, and risk management. And we're really aiming to quantify the frequency and severity of expected mortality from pathogens of high epidemic and pandemic potential. And using this type of approach really helps to solve for some troubling biases that we often see in estimates of pandemic risk, because these are typically relying on incomplete data. And we know that the universe of pandemics is much broader than what we've seen historically. So I'll kind of cut to the results. So based on our estimates, we have found that future risk is more substantial than generally believed, and it's dominated by respiratory pathogens. So we estimate that the global average annual loss from future epidemics and pandemics is about 2.5 million deaths. And we're not saying that these are the number of deaths that will occur every year, but rather these are events that occur more sporadically with huge spikes of mortality. And by way of comparison, this 2.5 million is very comparable to the annual lower respiratory tract infection level of mortality that we've seen prior to COVID. So it is comparable to one of the leading causes of infectious disease mortality. Another thing that we found from our work is that COVID-19 scale events are not once in a century occurrences, as some have claimed, but rather in any given year, there's a chance that a COVID level event will occur with a 2 to 3% chance. And if you look at this over a 25-year period, this actually comes out to about a 50% chance of seeing a COVID level event or worse. And this is, I think, a much higher chance than anyone wants to hear. And another thing is that these are a lower bound estimate, because only a portion of the risk space is covered by the pandemics that we looked at, because we only looked at respiratory pandemics and viral hemorrhagic fevers, and there are other types of pathogens that could cause pandemics. Furthermore, these estimates don't take into account the increasing trends that have been identified in the emergence of zoonotic pathogens due to factors such as climate change and land use changes. Furthermore, we only include risks of natural origin. And so another dimension that we do need to consider is the increasing risk of bioerror because of a rise in global biocontainment laboratories, and bioterror as well, because there's a growing proliferation and access to AI, for example, that could stoke this risk. And then lastly, we're also only looking at mortality and not the range of other health outcomes, morbidity, or even economic losses that others on this panel will share. And some knock-on effects that can occur in food systems, critical infrastructure, and the like. And so I think we have to keep in mind that these pandemics are not just a health issue, but really they're a much broader issue touching on many aspects of society. So tail risk, which is the thing that we're really looking at, can't be ignored. So through our modeling efforts, we also find that the distribution of potential losses is highly skewed. And we've seen events that are more severe than historical observations. So this calls to mind the West Africa Ebola epidemic of 2014, or COVID-19, a much larger coronavirus pandemic than many thought possible. Roughly 70% of the average losses I quoted, the 2.5 million, are actually driven by the tail of this distribution. So there's a small number of low frequency, high severity events with greater than 50 million deaths. And our modeling shows that there are events even worse than COVID that could happen, leading to hundreds of millions of deaths. And so all of this paints a really, really stark picture of what the future could look like. But I want to leave my comments saying that this risk can be substantially reduced. And with appropriate investments in pandemic prevention, preparedness, and response, there is a strong likelihood that we can reduce this risk. And one area I just want to touch on, and we'll hopefully get into this a bit more later on, is in this area of pandemic preparedness and response, is it's critical to build up the surveillance and diagnostic capacity infrastructure in countries around the world. there really need to be systems for continuous monitoring, because we need to be able to identify these events as quickly as possible if we want to really have the hope of containing them and really preventing a large amount of human and economic loss. These investments should be aligned with investments in health systems, which will bolster everyday capacities and work for pandemics too. And just maybe leaving on the note that nothing in the system is going to work during a pandemic if it doesn't work in peacetime. So maybe I'll just close with that and turn it back over to Victoria.
Thank you, Nita. You've just given us some really stark numbers here. We shouldn't ignore the tail risk. And the 50-50 chance is actually more than 50% chance in the next 25 years is what you're really telling us. And that it could be much worse than COVID. All right, so a little bit of scary numbers to get us started, but we'll next pass it over to Christina to talk us through some of these insurance tools. Over to you, Christina.
Thanks a lot, Victoria. Thank you for having me as a panelist today. And good morning, good afternoon to all of you listening. So I'm lead risk finance advisor at the Center for Disaster Protection. This is an UK-funded but independent organization, and our role has been in the past 6 years to advise humanitarian and development actors in preparing ahead of any crisis by preparing the financing and the plans that will help fight its negative impact. And we call this more generally the disaster risk finance discipline. My expertise is in pandemic financing, and actually I started my development career working with Nita at Metabiota in the early days as head of insurance solutions. So the idea was that if we are able to quantify, to model the epidemic risk and also the different probabilities of occurrence of all sorts of severities, then we should be able to build that into insurance policies that will insure governments, communities, businesses against the negative impacts of epidemic outbreaks. And very importantly, that will also bring the certainty that there is financing coming in the very early days of a pandemic, and how much of that is coming. The most known maybe representation of such products is the Pandemic Emergence Facility of the World Bank, or the PEF. This is to date the only global catastrophic bond ever designed specifically to respond to epidemic and pandemic events in countries receiving funding through IDA. Today, the PEF doesn't exist anymore. It has been discontinued in 2021. And we find ourselves with a gap in the system in terms of what we call prearranged finance. What we see in the global financing architecture today is we have several smaller scale and very importantly fragmented, highly fragmented facilities and instruments that are predominantly channeled via multilateral institutions. At the Center for Disaster Protection, we have recently carried a very early phase work to map the evolving policy, but most importantly, the financing landscape in epidemic response, both before COVID, so 2018, and after COVID in 2022. And we were trying to compare these two worlds. And what we see through initial analysis is that a very significant proportion of epidemic response funding, more than 85% of it actually, has been channeled through instruments that have either, one, not been dedicated specifically to fight epidemic events to start with, or two, hadn't been prearranged ahead of an outbreak. And, we're all hearing more and more these days about the topic of surge finance, and with the Communiqué from the G7 health ministers from last year, sending this important message about them intending to proactively address future pandemic risk through such a mechanism. It's interesting to just very quickly look at what actually they are proposing, because they are proposing a three-layer approach for early stage containment that builds on initial domestic resource mobilization, existing multilateral mechanisms, and thirdly, this is the innovation, if you will, it's this new dedicated surge financing framework that should deploy the necessary funds quickly, efficiently, and very importantly, without accumulating idle cash. This is the kind of mechanism that's very typical in the disaster risk finance space. So people like me have seen this layering strategy over and over again, but for climate shock events. We haven't seen this before in the pandemic and epidemic space. So this is great news. The ambition is great. But as Victoria was saying at the beginning, we have to learn from some of the lessons of its predecessors to be able to get things right this time around, and also, build the right principles in it. And I'll just talk about three principles, and then we can go into details later on. First of all, the timing of funds. Any surge financing facility, any financing facility for pandemic response needs to be activated early on, right? At the onset of a new pandemic, 0 to 6 months, so that the initial response measures are initiated and the transmission is reduced as much as possible. This kind of activation can also be found in the insurance industry, and it's what we would call a trigger mechanism. So if we learn from the insurance space, we know that such an activation has to do two things. First, it has to signal that there is a risk that has happened. In this case, the occurrence of an epidemic event. So it could be done through, for example, putting the stamp on case number 1 that's being confirmed. And secondly, it has to show a proof of loss. So in the case of epidemics and pandemics, this could be looking at the spread, at the speed of spread, at the pandemic potential, and so on. But it's very important that such a trigger is unbiased and it's reliable in time, so that any financing facility can be sustainable over time if it relies on it. If I go back to the pandemic space and we look into our world, what would be such a framework? What's the closest to a trigger that we have? Well, probably the WHO FAKES framework and declaration is the closest to it. But for it to act in that same way, it should be very, very transparent, first of all, in terms of the decision-making process. Second of all, the evidence base. At the time we are now, the resources are very limited. So donors are very unlikely to be agreeing very quickly to put money upfront on a just-in-case basis. And as in insurance, any global financial instrument has to prove the reason of its existence, and in this case, that it's better at addressing the epidemic risk early on. So this points to the gap that we're seeing right now in our space, is that there is a lot of work needed to build the evidence base about what is the exact impact of earlier finance, the types of interventions that should be best positioned early on and financed by this early money, and who are the right implementers of this early finance. Is it international teams or local teams? And I'll finish by talking very briefly about a concept that doesn't come from insurance, but it's very, very important in the disaster risk finance space, the concept of commitment versus disbursement. I cannot stress enough how different these are. And for a response finance mechanism, of whichever response finance mechanism, it can only be viable if proper national mechanisms can absorb the finance that's being put in front of them, and if plans are established to hold and absorb this finance. So there needs to be this alignment built behind reliable conditions for funds to be released in advance through triggers, as I've mentioned, but also what are the actors that need to be coordinated at the time of the disaster happening. This will ensure credibility and viability of any surge proposal even before the first dollar is put in a pot of money. Maybe I'll stop here and back to you, Victoria. Thank you.
Thank you, Christina. You've outlined a whole area of disaster risk finance. For many of us new to this space, it reveals, I think, just how much knowledge that's required to really get into depth into a lot of these questions of designing these instruments well. And the case that you mentioned of the PEF and the closure clearly has left a gap, and there still remains a need for some type of a prearranged insurance-based approach. And you've outlined very clearly some of the key principles and questions that need to be considered as if such a new instrument were to be redesigned. Okay, we'll stop here and pass it over now to Rashir, zooming us out. Thank you.
Thank you, Victoria. Very glad to be here with Carolyn, Nita, and Christina. So what I will do is use these few minutes I have to make 3 points. Who am I first before I get into point? I'm an economist. And I've been working a little bit on pandemic financing. During the pandemic, I was leading the IMF's multilateral response to the pandemic, and I co-authored the IMF pandemic plan, the $50 billion plan. And this event gives us an opportunity to kind of take stock of what we've learned, and drawing on some of those lessons, at least from the perspective of financing, I thought I will share 3 points from my perspective. So first, I wanted to emphasize that pandemics are a global security issue, not solely a global development issue. A lot of how donors are thinking about pandemic financing, they are thinking about it very much within the realm of development. And I want to emphasize that we need to go broader and think about it as a global security issue. So if you look at the estimate of the cost of the last pandemic we all lived through, COVID-19, the IMF, when I was working there, we had estimated that the cost up to 2024, so over 4 years, to the global economy was about $13.8 trillion. So at that time, the global economy is about $100 trillion. So just give you an idea of how large that impact is. Of course, the number of lives lost have now exceeded about 20 million. So the pandemics are extremely costly. And if, as Nita mentioned, even if you take the risk of a serious pandemic to be 2 in 100, so say 2 or more per century, their economic case for investing in, especially in prevention, but also preparedness and response, is very, very large. And so the logic of funding, therefore, for financing for pandemics is very different than the logic for, say, financing for global health. Some of the development funding richer countries do for the goodness of their heart, to ensure that humanity together can move forward in a more equitable way. But the logic of preventing pandemics is also for their own security. So we need to think about this and generating funding and mechanisms separately than just a development issue. So that's kind of point 1. Pandemics are a global security issue. Point 2, we need to really take a global goods perspective, not a country by country perspective. And if you see today, a lot of the pandemic funding that's happening, the new mechanisms that have sprung up, pandemic fund, the Resilience and Sustainability Trust at the IMF, they, by the nature of multilateral organizations, which are in a way inherited now for 70 years, are working the same ways, country by country perspective. But a pandemic today can start in any corner of the world and suddenly bring the rest of the world to a halt. And so the logic of funding or designing our funding mechanisms to just go country by country and rewarding those projects, we should not lull ourselves into comfort that yes, we have solved pandemic funding by just having some of these new mechanisms, because we need to ask, are we truly taking a global perspective? Are we truly doing more to reduce that likelihood that Nina mentioned from, say, 2-3% to 1%? What needs to be done? And what's the highest return for the next dollar that we spend from a global perspective? And so a good example of where some of that is happening, for example, is CEPI, which is investing in say, the beta coronavirus vaccines or other vaccines from other pathogens. And so I think these kind of investments are, more of those are needed, and thinking through what those priorities are very important. Last point is, so point 2 is we need a global goods perspective, not a country by country perspective. Point 3, I want to emphasize that we need day zero financing. What I call day zero financing is basically, as Christina mentioned, funding that can be activated on day zero of the next pandemic. And so the timing of financing in pandemics is critical. So we had done some analysis on this where we had looked at all the contracts, vaccine contracts during COVID-19, and we found that up to 75% of the delays on when countries receive the vaccines could be explained simply by the timing of when those contracts were put in place. And so often, for developing countries, the life-saving tools were purchased by multilateral institutions or institutions through, say, Gavi or Global Fund, and which were in turn coordinated through the ACT Accelerator. And at the end, the ACT Accelerator raised over $20 billion, but it took them several years, more than 2 years, to raise that money. If we had that $20 billion on day zero or first few months of the pandemic, the outcome and the trajectory of the pandemic would have been very, very different, and preventing many lives and livelihoods losses that we experience. And maybe we would not have that many new variants come up because the disease would have been fought more early on. So just to summarize the 3 points that I wanted to share with you in my opening remarks: pandemics are a global security issue, not just a global development issue. 2, we need a global goods perspective, not simply a country-by-country perspective, which is important but not sufficient. And 3rd, we need day zero financing. So that's kind of how I see what's next on the agenda, is to basically implementing those principles that I've shared with you into practice, as I see, and a lot of us collectively are trying to push the world in that direction. Thank you very much. Looking forward to the conversation.
Thank you, Rashir. You've already summarized your own remarks, but I will just make a point that your point about the ways in which COVID brought the world to halt, and in just reminding us that the actions that we do today can help to prevent us from having the world come to another halt again. And the global goods perspective that you mentioned, I think, follows very nicely in the sense that the day zero financing part that you mentioned is very key, in my view, to the global goods perspective, although there could be other global goods that we should be talking about as well. Okay, so I'll now pass it over to Carolyn, our last speaker. Over to you, Carolyn. Thank you.
Thanks, Victoria, and what a great panel. So let me connect the dots on a little bit of what you've heard from the previous speakers, and start by just taking us back to what the G20 high-level independent panel, which was made up of former finance ministers, financial and economic leaders from across the globe, their findings it'll be almost 3 years ago in July of 21, what they found in terms of looking at the pandemic financing landscape. And they found that this, as Rashir rightly said, this is much more than this is a global security issue. It's a global economic issue, and the world is far from equipped to prevent or stop the next pandemic. That we have a dangerously underfunded system, and we need a critical reset. At that time, they conservatively estimated that there was a need, in addition, for every country to step up its domestic resource mobilization in the area, domestic commitments in the area of pandemic preparedness and readiness, if you will, that we needed globally, because of the points Rashir just made, that this is a global public good, that we needed to invest globally at least about $75 billion over the next 5 years. That was counting from 22 onward, or about $15 billion a year. And again, a conservative estimate. And the good news is that some things have happened in the last couple of years, namely, as we've just mentioned, the creation of the Pandemic Fund in 2022. There is forward movement, as Christina was talking about, on a surge financing mechanism, but there's so much left to do. So if I look at this year and the sort of what are the key pandemic financing gaps, needs, asks, if you will, of leaders this year. So the first is the Pandemic Fund. And just a reminder, again, that was stood up by the G20 in late 2022. And it's still early days, but the ambition was to have about a $10 billion a year financing facility. We're not anywhere near that yet. There's about $2 billion that's been pledged so far. So we need to get closer to that goal. The demand is high from countries. The fund has already had one funding round of about $340 million. Demand for that funding was many, many times more than that. And this is grant financing. And that's important, right? Because a lot of the financing that is on offer in the global community is on the basis of loans, and not where countries, particularly low and middle income countries, are facing an increasing fiscal crisis, debt crisis, in large part generated by the pandemic itself. And so their ability to spend much more domestically is constrained. And again, as Ruchir said, this is a global public good. So there is a need to invest and incentivize from the international community a way to get countries to spend more, but also to spend more on the global system. So there is a plan to be a resource mobilization moment for that fund later this year in the context of Brazil's G20 presidency. And we need to get closer to that. If we can't get it to 10 billion in 1 year, at least I'm urging leaders to get at least halfway to that mark. And why not? There is money in the international system. It's a matter of prioritization. Christina talked about the surge financing mechanism. The G7 and G20 deliberations about that are ongoing, a bit too slowly for my liking. So there's really a need to crystallize that and get agreement on what that mechanism looks like and how it's going to be funded. In a couple of weeks, the African Union is meeting the summit, and they'll be actually formally launching an Africa Epidemics Fund that's been talked about for a while. The intention is for that to be funded by member state contributions as well as private sources. So that's potentially a promising another outlet. But again, it all comes back to political will to finance these mechanisms. But there's some other bigger, other opportunities which are not specifically just for pandemics, but could really be game changers in terms of the amount of resources that are available for pandemic financing on the global stage. Chief among those is the IDA 21 replenishment for the World Bank, which is just gotten underway. Pandemic preparedness is listed as a priority area for that, alongside climate and other global public goods. But there's a question about how much that will actually register as a priority. And so getting that into the IDA agreement on the scorecard of how IDA results are measured, specific commitments in the area of pandemic preparedness will be essential. There's also the Gavi replenishment that's slated either for later this year or early next. And while Gavi has a specific mission particularly around childhood vaccinations around the world, they do have additional funds available that could be committed for early response. And then Ruchir mentioned the IMF Resilience and Sustainability Trust, which was set up actually a couple of years ago specifically to deal with climate and pandemic preparedness, but we've not yet seen countries take that up for the purpose of pandemic preparedness, and that needs some dedicated focus and frankly, engagement with countries to see how best to leverage that resource. But of course, this is a very competitive financing landscape. And just within the health sector, WHO is looking for additional resources and is intending to have a huge resource mobilization effort this year. I mentioned Gavi. There's push for dedicated funding for antimicrobial resistance, and then preparing for another round for replenishment for the Global Fund next year. And then outside of health, of course, we know the congruence of global crises, the climate crisis and the push for massive climate financing, the wars in Gaza and Ukraine, food security, humanitarian, and national disasters. So it is a competitive landscape. And we're in an electoral environment. I think The Economist called 2024 the biggest election year in history, with more than 60 countries representing half the world's population holding elections. And of course, we know that in many countries, there is a strong populist or even anti-democratic shift. And so, but overall, whatever the political environment, we know that political leaders are increasingly have PTSD about pandemic preparedness, pandemic amnesia, if you will, and that pandemics have been highly politicized in many countries, including here in the United States. Politicians don't want to talk about it, and yet we know the impact that this could have when the next one happens. And then the congruent challenges of distrust of government, public health officials. Really, sadly, this space of pandemics has been politicized, and also this is a global challenge, as Rishi was talking about, which requires a strong multilateral commitment, but we see multilateralism under threat. So all that's to say that to conclude, again, as I said earlier, I think there are opportunities to move the needle in 2024. We do need to get a pandemic agreement done. That is a set of negotiations underway at WHO. The intention is to try to reach an agreement by 2024. That's not going to solve the financing question, but it could force the issue of how to pay for it if we have a global agreement. And of course, we know a global agreement will be toothless without additional long-term financing. I would stress here, we do not need a new financing mechanism out of that. Maybe we do, but that would be after we fully resource the mechanisms we have. And then get the pandemic fund fully and sustainable resource on that path to 10 billion a year. The bottom line is we have to re-elevate pandemic preparedness response on policymakers' agendas. There's opportunities to do that at upcoming summits, including the UN General Assembly Summit for the Future later this year, which is about emerging threats. But we have to reframe, we have to enlist new champions to this cause, whether they are in climate, whether they are in economics and finance, national security, as Rashir said, to reiterate and remind people how pandemics do actually affect every sector, every system, every country, every population in the world, and we don't want to go back there. Thanks.
Thank you, Carolyn. You've drawn a rough landscape of, as you mentioned, a very competitive space where there's a lot of competing priorities, so many things that donors could potentially fund, things that we're not funding adequately. And you also made a comment just briefly, I'm not sure if you had much more thought about it, but you said not to create new things. But I think that's one question that we have for this group is there a new thing that should be prioritized? And related to that is what's missing? What's missing from the current landscape? Is the pandemic fund adequate for some of the global public goods perspectives that Rashir had mentioned, or even broadening from outside of a development lens to a more national security lens? So I'm gonna just open up the discussion here. Is what's missing? What do we need, or what's on the top of your list? If you had to, if you're managing the treasury funds here and deciding, okay, I have to do something for pandemics, where are you going to put it? Something new or something old? Rashir, just calling you.
Okay, I was not planning to say something per se, but I have a clear I have two things I would love to see. I agree with Carolyn, may not need new vehicles, but we need money. So first is day zero financing. So it can be channeled through existing multilateral organizations, but we need commitments from donors to activate, say, $20 billion inflation adjusted on the first day of the next pandemic. And so and then have a governance structure around that can come to life when that trigger, as Christina talked about earlier, is triggered. The second thing on my wish list is simply more prioritization on prevention. So here's a simple logic for that point. So today, if Cape Verde borrows money from the pandemic fund or Resilience Sustainability Trust and invests in own pandemic preparedness response, most of the returns from that investment will go to Cape Verde, and it's for a good cause. But unless Cape Verde itself is a good source of pathogens that can spring over to other countries, that return may not be as high. So if we can have a global perspective of where those hotspots are and prioritize those investments, and some people actually taking ownership of thinking through what those investments are and use our existing governance frameworks to implement that's God's work.
Thank you, Rashir. So you're arguing for we don't need anything new per se. We just need to make sure that those commitments are there and that we channel them through the right channels, and that the governance arrangements can so to speak, spring to life at the right time. And you made a compelling case for hotspots and prevention. I'll pass it over now to Christina on this question. What do we need?
Thanks, Victoria. Just in a sentence, my wish list is for, as I was saying, a more inclusive and cohesive system when we're designing the next generation of pandemic and epidemic risk finance instruments. And I really like your framing about something old and something new, because I have actually some very specific wish, is to learn and scale from existing smaller initiatives that have been around for a few couple of years now, and they embed good practices in, engaging local stakeholders in the design, or working with contingency plans, not just with finance, and then aligning responders behind those funded plans. So concretely, something old that we've reshuffled during the COVID response as a lesson learned, if you will, are the contingent loans of MDBs. And these have been, during COVID times, the most common and sizable form of prearranged finance that have been made available to countries for health emergencies. And they have been used in some cases, especially at the very beginning, on an exceptional basis, because none of these contingent loans, or very few of them, had in their rules of disbursement eligible expenditures related to epidemic and pandemic events. So they were not fit for purpose, if you will. They were made, scrapping them, they were made fit for purpose. And then they became, in the meantime, a standard loan product in most development banks. But on that something old, I would hope that more work is put into these instruments, one, to make them fit for purpose, but two, to also make them available to, more broadly, to low middle income countries. Because contingent loans typically are budget support instruments. They don't ask for a contingent plan of response, but they do ask for prior actions in terms of macroeconomic policies and reform. And some of these are not suited for low middle income countries, where also some of the deadliest epidemics occur, because they also hold the biggest zoonotic reservoirs. So that's my one wish list on the old. And on something new, I want to touch on a form of insurance, which is called the risk pools. I don't know if many of you know about them, but they are global mutual insurance companies and agencies that have been set up in the past 10 years by the international communities and MDBs, and they are still supported by them. And they usually cover a continent or a region. So they are mutuals in the sense that their shareholders are their member states. So you have on the African continent the Africa Risk Capacity, you have in the Caribbean the CRIF, in the Pacific you have the PCRIC, and in the Asian you have the CIDRIF. And the intended role of these risk pools is not to work as a commercial insurer, but to work as a development insurer. This is a whole new term, but it really means they are at the heart of the risk finance agenda for low middle income countries. And historically, their role has been super important, as they have provided technical assistance and risk coverage, but exclusively for climate shocks. But given the kind of long-lasting relationship they have with their member states, there is no reason, in my opinion, why these risk pools couldn't be taking forward as well the pandemic risk finance agenda in parallel, not cannibalizing, but really in parallel to the climate agenda, by, for example, scaling up their product offering to add sovereign insurance products for epidemics and pandemics. And I'll just give one example. It has been possible, so we know it's doable. One of them has actually demonstrated this to be feasible by launching an outbreak insurance cover for the government of Senegal at the end of 2022. It took very long, and some of us in this call were involved in it. But what the lessons learned and the importance of the process makes it possible today to take that forward and scale it up in other countries and regions. So I would really hope that this can be done by other risk pools as well.
Thank you, Christina. You've mentioned this importance of revisiting these so-called older contingent loans, as well as looking at these regional risk pools and thinking through how they can really be scaled up. Thank you. I'll pass it over now to Nita.
Yeah, thank you. Just to kind of echo what some of the folks have already said on this call, I fully agree that these pandemics are really a national security issue and something that we have to take that lens and not just focusing on health systems, but all of the parts of the economy, food security, geopolitics that are involved, and really investments in broader resilience are key. I also wanted to pick up on some of the things that Ruchir mentioned about, focusing on prevention, looking at hotspots. I think here we have a really important opportunity to use a risk-informed lens on where to make these investments and to really understand where the emergence of these types of events is likely and what areas pose the greatest risk. And I think we can use these types of tools, including modeling efforts and information of that nature, to inform where the biggest return on investment will be for these types of events. And then thirdly, I also want to mention, to pick up on Christina's point on a lot of these disaster risk financing mechanisms, they're predicated upon knowing when an event is occurring. And it may seem like something that would be obvious, but in fact, the system right now for detection of when a pandemic is nascent or when an event is in its early stages is actually still falls quite short from where it needs to be able to truly support these types of mechanisms in the most effective way. And so one of the ways that we've been thinking about how to improve upon this is really to have more continuous monitoring systems, to have the data flows coming in, to be able to fill in gaps where information is not available. And I think with this kind of information, especially with some emerging fields such as in wastewater-based surveillance and epidemiology and environmental sampling, and then looking at genomic surveillance, which is another area that really hasn't been used very much in these kind of financing mechanisms. I think there's a lot of promise and potential in these technologies to really get at the very early stages of a pandemic before it even becomes a pandemic. How do we know when something has just emerged, a spillover event from animals to humans? Will we one day be able to tell when or how that would become a pandemic and prevent it before it reaches that stage? I think that would be the ultimate dream, and I think science still has a long ways to go, but I think we can start with having monitoring to establish baselines and know what's actually normal and what's out of the ordinary.
Thank you, Nita, for reminding us the importance of information, which is crucial for timeliness and in some sense is also a global public good. And could be a big focus of what could be done for pandemic financing potentially. Although you could argue with the WHO's new hub that is attempting to fill in one important role of that. But the question is, what else needs to be done? Is that adequate? Well, Carolyn, did you want to add anything on this question about what's missing?
Well, just very quickly, because you framed it as old and new, and we do need day one response financing, and we need to make sure we don't repeat the travesty that which goes to a larger sort of an agreement and mechanism of ensuring that every country can access the vital countermeasures and tools they need when a pandemic happens. But again, that's perpetuating the focus on downstream response and not on upstream prevention and preparedness. And so I do go back to the pandemic fund, which is both old and new. It's there, but it is still in its infancy and not anywhere near where it needs to be. But it took such a effort to get political agreement at the highest levels, not just with the G20, but then broadly, every country that is a member of the World Bank signed off on creating this thing. There was extensive discussion in the global community about this, and the reason it was created was to fill a gap in the system, and we are just sort of dipping our toe into that. So I think there is always a tendency of politicians to focus on the next new shiny object, and let's not forget the thing that was actually just created to build dedicated long-term additional financing, and let's move that forward.
Thank you, Carolyn, for reminding us about the baby that was just born, that we have to help the baby to grow up. We've been talking quite a bit about where the next tranche of money can be found, but I want to talk a little bit now, shifting to some of the residual COVID monies that's been discussed in the news from Gavi and Global Fund. If you guys had just, again, going back to your wish list, if you could reallocate, if you had a magic wand and could reallocate Gavi and Global Fund residual COVID monies, just on just one thing, because I know you guys have been sneaking 2 or 3 things in there, but just one thing. Can we all agree on what that one thing is? Just amongst the 5 of us here.
I mean, that money was raised for a response to an emergency. It should be redeployed. If it's going to sit with those organizations, it should be redeployed for that purpose. That's the basis on which it was raised, with taxpayer money, to respond to an emergency. So let's repurpose it for that in whatever fashion makes sense.
Thank you.
Perhaps I could add something to Carolyn. I do think there is a governance issue here. So there is a difference between WHO, World Bank, IMF, and Gavi and Global Fund. The big difference is, there is a multilateral system with a board, with all countries having a vote, and that can lead to some slow responses. So that's kind of downside. But the upside is there's transparency and there's a system of accountability. Now, from my perspective, if you look at the pandemic fund, it was started with an initial grant of 1.3 billion or so, right? That was enough to make the baby born, as you say, Victoria. So now, if you compute, at least for Gavi, I've done some calculations, and thanks to great work by Anne, who's a journalist from Norway for Development Today, I think that's how they call it. Yeah, there's a lot of numbers she has computed that shows that the amount of unutilized funds from Gavi COVID-19 funds could be up, $3, $4, $5 billion. Now, from my perspective, it's important that there's a good, clear governance decision of the donors on how to strategically and best use these funds for what's good for the world. And I think that's a great opportunity. So where now, to answer your question directly, where would I want to put, even if I could get $1 or $2 billion out of that, I would find a way to put that as a base money in this day zero fundings fund that I speak about. So that could be enough to leverage other contributions, such that we don't necessarily need money to lay around idly, right? That as the G7 has instructed or wished, let's say. But you can use this as an innovative way to pool in and get more contributions from elsewhere. So that's where I would want to put it, and I would definitely want a much better accountability of funds used, especially from organizations that are not subject to the UN system.
Thank you, Rashir. So we should use these residual funds and really get this day zero financing mechanism started. Many of us all agree that we should do it. Last year, the G7 and DFC proposed something to try to spearhead something similar, but still there's a lack of resources to kickstart such an initiative. Well, I'll pass it over to Nita, who has some thoughts as well.
Yeah, just wanted to add that I think certainly the funds that are continue to be available should go towards relevant needs. I think we do need to keep in mind that we shouldn't over-index to COVID, and that the next pandemic may look very different. And so really the key is to be prepared for a broad range of potential threats. I think the other point that I haven't heard a lot discussed on this particular call is that we have to kind of think of pandemics in terms of not just the technological and financing sort of aspects, but also on those lines of it being a whole, society level threat that this is a social phenomenon as well, and that we do need to think about ways of how to invest in building public trust and engaging more with civil society and all of these aspects to try to really build from the ground up a lot of that lost trust that we saw that happened during the COVID-19 pandemic. And I think that's really a critical dimension that's often missing from a lot of these conversations.
Thank you, Nita. You've hit on what I view as an extremely crucial but also really difficult and vexing problem, which is this fundamental issue of trust and the backlash, and not just amnesia, I would say, but actually a backlash against all things public health. We're seeing it now with the burst in measles, the low vaccination rates around the world, partly due to, of course, the lack of access to essential services during COVID, but also due to the lack of trust for all sorts of reasons. Of course, misinformation is one of them. But even the ways in which the public health community communicated, I think, is also worth reflecting on as well. No easy answers, I'm afraid. I want to turn now we just have just a few minutes. How an hour has already passed. We've got such really fantastic questions here in the chat, including some on civil society and the role of the private sector. We've got a question from Port Demon about political will and how should we really think through gaining political support. A very detailed question about the PEF and what went wrong with that. Almost a whole can of worms for perhaps another day, but really worth exploring. And then finally, this question that I think is almost an existential question for the global health community, which is about a fear of one slice of global health cannibalizing another slice of global health. Although as we've just been arguing, it's not just limited to global health. This is really a much broader perspective, not limited to even development, but national security, as Rocio had mentioned. I want to and also another comment about transparency from David Bryden and the need to really understand how these monies are being spent. And even some ideas about where this residual funding could potentially be used for, even a possibility of even the long COVID questions. There's just too much to discuss. I really hope we can continue this conversation offline, by email, or reaching out to us or individually. There's so much more that we need to do this year to really advance this agenda. I haven't given my perspective if I had to just have one wish list, but I will put all my chips on Ruchir Agarwal's idea that we really need that day zero financing set up. If we're going to throw together the ACTA accelerator again, it's going to be 2 years too late. And it was a small cost, $20 billion or whatever it was. And in the scope of things, the $13 trillion of loss, this is really just a slice. It's just pennies that we're talking about. And the potential for preventing much less severe losses is just so large. We really owe it to our future generations to get this right. More questions continue to come in. We're going to have to stop here, but we hope to keep on talking further. And I want to thank all of you, all of my excellent panelists and speakers, as well as all of our really engaged audience, and keep on pushing this really important agenda. So thank you very much, everyone, and we'll be in touch. Thank you, everyone. Bye-bye.